preparing the wounds. If your lesion is very bloody or has a lot of pus, for an example, if I had poured and then you have this liquid pooling here, obviously that liquid or blood is going to create a lot of conductivity and it's going to generate too much heat. So mop up any extra blood or pus. You do not want that extra area. Second of all, if you have a very large, for an example, if it's a very skin cancer or a very calloused, you can debulk that tumor down, mop up any blood from the debulking, maybe even use some Munzels to stop the bleeding, and then you can treat right on top of that area. We were talking about how we were not having that continual rate of climb in the pitch or the temperature because this area had dried out and was not wet enough. After the application of saline, you can see how that extra moisture in that tissue is now having it climb quite rapidly and on a consistent basis. That really is what you're looking for during the treatment. So a couple things is, if that area is quite dry, calloused and that, take some saline solution on a gauze or a cotton pad and apply it to the lesion and let it sit for about 10 minutes, and then that area will get moist. Again, no standing pooling water or blood. Now, when we generate the heat from within the tissue, and it brings it to 120 degrees, is that heating time frame is typically, as you could tell, about a 30-second time frame. It can be painful. So what we do is we utilize topical lidocaine and we eject the lesion with lidocaine, typically about 1.5 or 2%, in order to anesthetize that area. If you are in a situation where lidocaine is not able to be utilized, we have had people treat the patient without the lidocaine. It is painful, but it can be for a short time frame, and with compared to other types of injection treatments, can be still considered okay. The other thing that you want to understand is after the treatment, it's kind of an interesting thing, is the biggest part of that potential pain is during the ramping. When the temperature hits that 120 or Fahrenheit or 50 C, what we have found is that the pain actually stays stable or decreases, and we think that that's the effect of the heat anesthetizing some of the nerve endings in that area. So we do recommend lidocaine, but we do understand in some field applications it's not available.